Buju. It has now been 5 years since our team joined the Johns Hopkins Center for Indigenous Health, and officially 5 years since our grand opening launch for offices here in northeastern Minnesota. Back in 2019, our Great Lakes team included 4 full-time team members, a number of students, and about 80 tribally based research partners across Minnesota, Wisconsin, and Ontario. At that point, we had already been doing research together for about 15 years, and we had learned so much about the protective influence of Indigenous culture on health, and also about the devastating impacts of colonization and historical trauma within our communities. But we knew we could do more. We decided together, reaching consensus from nearly 100 people, to take a leap and move our team to Johns Hopkins. We were hungry to share what we had learned with other Indigenous communities, and we wanted to learn about the remarkable successes the center had in promoting Indigenous-led public health training and programming. Since 2019, our Great Lakes team has grown in so many ways. We've quadrupled the size of our staff, our offices, and our grant-funded projects. Much more importantly, we have been privileged to engage with our colleagues at Hopkins, other institutions, with policymakers, foundations, and philanthropies, and with international Indigenous colleagues to celebrate the strengths of Indigenous peoples across the globe. We've also been honored to recruit and support Indigenous students in our center's institute programs and across the various graduate degree opportunities available at our university and through the Bloomberg American Health Initiative. As we look ahead, we have big dreams. Our research, training, and practice at the Great Lakes Hub is meant to promote Indigenous flourishing in all forms. But we pay specific attention to harnessing our cultural strengths. We aim to engage in projects and activities that support specific aspects of Indigenous community cultural reclamation and revitalization, including things like connectedness, positive cultural identity, reclaiming our Indigenous food systems, and language revitalization efforts. We will continue to do community-based participatory research and uplift Indigenous ways of knowing and research methodologies, all while working to support and affirm tribal sovereignty and self-determination. We are so grateful to our partners in Indigenous communities and to all of our colleagues at Johns Hopkins and the Bloomberg American Health Initiative and at the Center for Indigenous Health for your support over these years. Chi-miigwech, big thanks. We can't wait to share what's next.